Good morning. Thanks so much for joining us for Face the State. I'm Tracy Townsend. We're starting today with an issue impacting every Ohioan, the rising cost of everything.
The bottom line is this. My top priority is fighting inflation and lowering prices for families and things they need.
Even though it's expected to drop, inflation is hitting almost every aspect of our lives, whether that's food, power, or gas prices. In fact, new government figures show annual inflation did ease off a bit last month, but it's still near a 40-year high. It's part of the reason President Biden said his #1 priority is making life affordable for vulnerable Americans.
I know the families all across America are hurting because of inflation. I understand what it feels like. I come from a family where when the price of gas or food went up, we felt it. It was a discussion at the kitchen table. I understand. That's why I've got a plan to lower the cost for everyday things that make most people who work to have, who need. And that would have fundamentally changed the standard of living if we just made things more affordable. There's more than one way to deal with the impact on a family than what we're doing, and we're going to beat inflation. But beyond that, it's all about quality of life.
The administration is considering ending tariffs on imported Chinese goods to lower some consumer prices. Inflation is impacting the cost of diapers as well. A growing number of families can't afford them, and those who provide free diapers are running out. 10 TV's Kevin Landers explains what you can do to help.
Last year was a record year for diaper deliveries from the Columbus Diaper Bank, with 380,000 children served. This year, they project 500,000.
We were up by 48% by diaper distribution from the year before.
But this year, the demand is even greater, as evident by this half-empty warehouse.
And what do you attribute the demand to?
The economy. The lack of people working out there, being able to find a job that's, well-paying to support their family.
Sarah Poston knows that feeling. As a mother of 3, she would come to places like Little Bottoms in West Columbus to get free diapers.
It was a lifesaver.
She says places like this helped her stretch her budget. Even with her and her husband working, it was a tug of war, she says, between paying for diapers or keeping the lights on.
This $25, $30 can actually go a really long way for the other kids that are in the house that we need food, or we need to pay another bill to keep the gas on, keep the electricity on, keep that water running.
To give you an idea of the demand for diapers, at this single social service organization called Little Bottoms, last year at this time, they served 500 kids. This year, they're at 1,100, more than double.
The executive director says 70% of the families who come here for diapers earn $20,000 a year or less.
And we know that for an average family, it costs $80 a month to just put diapers on one child. So, that's a heavy cost when you are literally, accounting for every dollar in your budget.
Ohio is one of several states that continues to charge sales tax for diapers. The states highlighted in red don't charge sales tax on diapers. We brought the issue to both candidates for governor. Governor Mike DeWine's spokesperson said, quote, "We are actively considering the feasibility of removing the sales tax on diapers, and we'll be exploring this with the legislature." Nan Whaley's team told us Nan is certainly open to looking at ways to further ease those costs, including eliminating the sales tax on diapers. Meanwhile, diaper banks like this say they could use all the help they can get. For now, they're able to provide 50 diapers a month per child, but that will depend on how long their supply lasts.
I worry all the time.
Kevin Landers, 10 TV News.
Free financial advice is now available to everyone in Central Ohio. There's a new program that's a partnership with the City of Columbus and Jewish Family Services. You can sign up for one-on-one sessions with a financial counselor. Those sessions cover whatever you want, including increasing your credit score, getting a loan, or some saving strategies. Again, sign up at 10tv.com/featured links. Ohio lawmakers are debating a bill that would limit local governments from claiming that they're immune from crashes involving government vehicles. Representative Catherine Ingram said her bill was spurred in part by the work of 10 Investigates. It was introduced this week and appeared to gain some support from fellow lawmakers. Let's listen into part of Ingram's testimony.
Further, TV10 Columbus, through an open records request, reviewed 108 claims filed with City Attorney Zach Klein's office since 2018 and found that in 60% of those cases, the city denied paying individuals for property or vehicle damages caused by collision with the Columbus Division of Police. The legislation will bring Ohio in line with most states in terms of municipal liability.
Representative Ingram was referring to our investigation last summer. That's when we found drivers hit by city vehicles like police cars were being stuck with repair costs, even when the police officers were at fault. You might ask, how's that possible? The city claimed the officers were immune from liability because they were responding to emergency calls. Then Investigates found it didn't matter if they were actual emergencies or just non-emergency runs. Quote, any call to duty was deemed an emergency. Lawmakers have tried to clamp down on that too, and now Representative Ingram's bill would further restrict local governments from being able to claim that they're immune.
That a citizen gets hit by a government vehicle, doesn't matter who it is, that we wouldn't do everything we can to make one of the citizens whole has been mystifying to me. So I look forward to following this. I haven't obviously been as involved as you have been, but I mean, this needs to get taken care of.
Representative Ingram says she does expect some pushback from law enforcement and municipalities who might concern that they will end up footing the bill or that their insurance will rise for every claim. Former Cedar Point employees are raising some new allegations of sexual assault, harassment, and hiring concerns. It's an update to a story we've been digging into for months. Just a week ago, we aired our first investigation. We found 27 reports of sexual assaults dating back 5 years. Former employees who've come forward to say that they were victimized while living and working at the amusement park. Now, state leaders are pushing for change. Here's Chief Investigative Reporter Bennett Haverly.
Since 2017, 27 reports of sexual assaults made to local police, claims of traumatic experiences tied to those working for Cedar Point. Now, a growing chorus of former employees say their complaints were ignored.
So you feel like Cedar Point's response to what happened to you was inadequate?
Yes.
This former employee asked not to be identified because of what he says he endured. He worked at Cedar Point for 3 summers, eventually becoming a supervisor, while trying to put out of his mind what he says happened to him.
He approached me in the control booth of the ride, and he tried to get physically touching me and like sexual gestures, trying to make me want to do stuff with him and like making verbal comments towards me. I immediately told him, no, that's not appropriate. I'm not interested in anything like that.
He says he reported this incident and another involving explicit phone messages from another employee to park management. He tells me he turned in a form to Human Resources, but that neither employee was punished.
It makes you feel very uncomfortable because, you know, they're your managers. They're supposed to be there for you, to work with you, make sure everything's going well for you at work. And it seems like they just push it to the side because it seems like they're always focused on staffing. We want staffing.
His comments echo what these former employees told my colleagues at our sister station in Toledo, WTOL.
I mean, I would like to see Cedar Point kind of take responsibility for their mistakes. It seems as if they are just refusing to speak and brushing it under the rug.
These women say they worked in human resources and that during the pandemic, there was added pressure to hire staff, which meant in some cases doing so without completing proper background checks.
When I first started, I know it was a little bit different before I started when, they started, but it was basically just if they pick up the phone, you were, supposed to hire them. It didn't matter if they gave you a crap interview or not. They were more worried about the staffing inside the park than they were of the well-being of their associates.
Of the 27 reports of sexual assaults, 10 happened last year. In an emailed response, a Cedar Point spokesman said the park performs background checks on new associates, adding that it has been a long-standing practice and that if there are issues uncovered in the background check, we take appropriate action up to and including termination. That response did not address our questions regarding these additional claims of sexual assault and harassment that we've been hearing from past employees.
They should be able to feel that when you go to work, that you're working in a safe environment and that your employer is looking out for your best interest and is going to be there in your darkest hour.
State Representative Lisa Sobecki of Toledo, who told me she too is a sexual assault survivor, said she understands the trauma these employees have alleged. Last week, she crafted this letter to Cedar Point's CEO, telling the park the allegations are deeply troubling and that they've revealed an unacceptable pattern. She told 10 Investigates she has not heard back.
No response is troublesome when there's, when there's these allegations that are being made, and it's not showing me that they're really taking this serious, and they need to take this very serious.
And again, that's 10 TV's Bennett Haverly, our chief investigative reporter, covering this story. As we reported on Friday, other elected leaders have now weighed in, including the governor and U.S. Senator Sherrod Brown.
Their reputation's been hurt by this, and they've got to fix it, and they've got to make sure from now on people need to be punished that didn't do this right or that committed any kind of crimes, and they've got to make sure from now on every parent that sends a son or daughter to work at Cedar Point needs to know that it's a safe place.
If you or someone you know is dealing with sexual violence, 10 TV wants you to know there is help available. You can reach the Ohio Sexual Violence Helpline at 844-644-6435. The Senate voted to block an abortion rights bill earlier this week. This morning, we are hearing from Ohio activists about this historic decision. Welcome back. Just this week, the U.S. Senate voted to block an attempt at ensuring abortion rights as law. The block was a 51-49 vote. And now there is reaction from both sides here in our state.
It's deeply disappointing because right now the U.S. Supreme Court is on the verge of overturning Roe versus Wade, which could allow states across the country, including Ohio, to ban most, if not all, abortions. And we know that that is going to have a devastating impact on people, on really everyone, but it will be felt most heavily by people who already are facing devastating barriers to access to healthcare, including low-income people, Black and Indigenous and other people of color, immigrants, young people, people with disabilities, people in the LGBTQ community, particularly trans people and gender non-binary people. And of course, as we know well in Ohio, people living in rural areas and other medically underserved areas where access to reproductive health care is already severely limited. So it was deeply troubling to see that we did not have enough votes in the US Senate to ensure that Americans have a basic human right to bodily autonomy. Americans, I think, rightfully expect that our elected leaders will protect our human rights. And it was a deeply disturbing vote.
We're elated. The United States Senate put a piece of extreme legislation on the floor, and they couldn't even get to 50 votes. They couldn't even get to half. In fact, it was bipartisan opposition to what Chuck Schumer and the Democrats put on the floor. It failed 51 votes to 49 votes. The United States Senator from West Virginia, a Democrat, voted with all the Republicans to vote no. So it never got to 50 votes to even consider. Some people are talking about you need 60 votes. They couldn't even get to 50 votes. And it was bipartisan opposition And we're elated because we believe, and we read the bill 4 or 5 times, it was extreme as it gets. It would have eliminated every single regulation in every single state across the country, to include here in Ohio. We have a parental consent law. A minor can't get an abortion without a consent of a parent. If Chuck Schumer and the Democrats bill would have passed, it would have eliminated parental consent. It would have eliminated 24-hour waiting period. It would have eliminated all the health and safety standards we have currently for abortion clinics in Ohio. That's extreme and wrong. And I don't believe any American, regardless if you're pro-life or pro-choice, supports that.
You will recall about 2 weeks ago, a Supreme Court document was leaked suggesting the justices would vote to overturn Roe v. Wade. It was a draft document. If that draft does turn out to be how the Supreme Court votes, it would be up to states to decide where they stand on access to abortion. But at this point, any person who needs or wants to have that procedure in the United States can legally do that. We should also note Ohio is currently working to get 2 so-called trigger laws passed. A trigger law ensures that if Roe v. Wade is overturned, our state would make abortion illegal immediately. Senate Bill 123 and House Bill 598 still in the works. Those pieces of legislation would include exceptions that would give a person access to abortion if the pregnancy was life-threatening. We will certainly continue to watch this situation and unfold as it unfolds and report back to you. Right now, a team of Ohio lawmakers is hoping to ensure more rights for LGBTQ plus Ohioans. State Senator Nikki Antonio is reintroducing the Ohio Fairness Act. Its goal is to ban discrimination based on sexual orientation, gender identity, or expression.
This is why this bill is so important to me. Everyone in a democracy, everyone has the right to live their authentic life. And so if right now people are being denied being able to do that, then that requires advocacy and good public policy like passing the Fairness Act. Now, the other thing we haven't even talked about is the fact that it's good economic policy as well. You know, we hear all the time about Ohio wanting to attract big businesses. Intel is going to set up this huge expansion in Ohio. Other companies like Google and Facebook and Amazon either are setting up places, have places ready, or want to expand. What do they need then? Talent, the best and the brightest, right? And so if we're going to be a state that welcomes those kinds of businesses, who, by the way, all have the policies in their companies of protecting the rights of LGBTQ people, if Ohio says we're open for business and we're welcoming everyone to come here, then we need to be real clear about providing these protections so that people do feel safe, that they can bring their family, that they can live their lives without the fear of discrimination or bigotry, put their kids in school, and everything else that involves just living your best life and being part of a community.
We should also note that the Ohio Fairness Act is a bipartisan bill. Senator Antonio says if it passes, the LGBTQ community would have better access to housing and to jobs in our state. May is Mental Health Awareness Month, and ahead we take a deeper look at how mental health impacts coaches in our state and a bill that is working to teach them some new skills. A new bill in the works could make mental health training mandatory for coaches. 10 TV's Kevin Landers has more on why some believe this bill could save lives.
Work together, work together.
Head coach Matt Triplett of St. Francis de Sales is unique. Not only can he spot a good lacrosse player, he can also spot one of his athletes who may be struggling with a mental illness.
Having that knowledge that I'm prepared to handle that conversation, the amount of kids that have come forward has tripled, quadrupled, quintupled, whatever metric you want to put on it. It's been a noticeable change ever since I've gone through that.
4 years ago, Triplett completed a mental health first aid course through Ohio's Adam H. Board, or Alcohol, Drug, and Mental Health. It was then that he realized how valuable the training is and thought his fellow coaches would benefit.
So the training was absolutely incredible. And, and I've utilized that training, I think, more in the last 18 months after COVID than 24 years of being a head coach.
Let's go, full speed, full speed.
Triplett says his training has helped him better relate to the kids he coaches because they know he has the training and he's able to recognize the signs of mental illness that kids may not want to talk about. He recalled one student who complained about food poisoning every time there was a big game.
We started to kind of see a pattern, and I was able to identify that as anxiety. I was able to reach out to the school counselor.
Triplett reached out to State Representative Mike Lochek. The U.S. Air Force veteran underwent similar mental health training when he was enlisted.
I think the benefit of this bill, the biggest portion, is that we're going to have coaches that know how to react and identify portions of, when kids need help.
House Bill 492 would mandate mental health training for every coach in K through 12. It would tie into the existing Lindsay's Law, which already requires coaches to have training for sudden cardiac arrest as well as concussions. And coaches would have to have this training every time their coaching certificate is renewed.
Ah, good D, good O.
As for Triplett, he believes the more coaches who can understand what their athletes are going through mentally, the better the player and the person can be.
Anytime something happens in the mental health sphere, whether it be suicide, eating disorder, or attempts on their own life, everybody is always trying to get trained after the fact, after it's made personal to them. This bill will get out in front of that.
Stay with it, stay with it.
Kevin Landers, 10 TV News.
The legislation went before the Primary and Secondary Education Committee in March. We are going to watch that and certainly keep you updated on its progress. 10 TV has been talking about mental health awareness all month, and we want to remind you of a resource if you or someone you know is struggling. Call 800-273-8255, and you will be connected with a trained crisis counselor in just 5 minutes. Thousands filled the streets of downtown Columbus on Saturday to raise money for research and a cure for breast cancer. Long after the final person crosses that finish line, the work does continue, and it moves beyond that 5K course to the State House. I talked with Jennifer Nelson Carney, who is on the KOMEN Public Policy Advisory Board, one of several volunteers around the country working to help set public policy priorities every year.
And that's one of the things I'm really proud of KOMEN for. Of course, we're known for Race for the Cure, which is a great event from a fundraising, awareness, and celebration standpoint. But KOMEN does many other things, advocating for patients, driving research, and importantly, improving access. And as KOMEN works around the country to try to influence state legislatures to make changes to get more access to patients for care and treatment. That's something that KOMEN's been really focused on, and I'm excited to say that we've had some movement on that in Ohio.
Are there one or two big issues or examples that you can share with us today?
Last year, under the state budget bill, there was an expansion of eligibility for the breast and cervical cancer project. Some people know this as the BCC project through ODH. And the expansion was to allocate additional dollars so that more women can have access to breast and cervical cancer treatment. So we were so excited about this because it enabled women who maybe wouldn't have had access before because they were underinsured or uninsured to have access to treatment. And it makes such a huge difference for any woman that needs that care, but especially women who are of low socioeconomic status or racial or minority groups that do not have great access to healthcare. This is going to make a huge difference. And I'm really proud of KOMEN for advocating for expansion of coverage and treatment like this, because those things make a real difference in the lives of everyday people.
And Nelson Carney says patient navigation is also important. KOMEN works to provide patient navigation resources to patients so that they're aware of the services that are out there and available to them and how to make and get that access to those services and access to treatment. We thank you all for joining us here on Face the State today. Have an excellent week.